commissioners.
Yeah.
The commissioners who are not attending today's meeting includes just Tanya McDaniel, who is on vacation, and Commissioner Richard Linville is not with us in person today, but he is with us by remote, and Commissioner Linville will be participating in the briefing session as well. We have a number of items today, including a discussion item from Cardinal Innovations with an update from Karen Bentley. I'm glad to have Karen with us today. And a behavioral health budget discussion with Chantel Robinson, who is the Deputy County Manager. So we have a lot on the agenda, quite a bit to talk about. And we will begin today's meeting with our fine County Manager, Dudley Watts.
All right. Thank you, Mr. Chairman, and good afternoon again. So two discussion items, and then we do need to finalize the agenda for the May 6th meeting. Just a reminder, this is next Thursday is a fifth Thursday, and so we will actually not be in session next Thursday, so everybody can enjoy a week away as we head back into the meeting on May the 6th. And then we do have one item for closed session, which is a personnel matter. So that's what today looks like. And I guess we'll kick off, Mr. Chairman, if it's okay, with the quarterly presentation from the LME MCO, and Karen Bentley should be on the line. Karen, are you there?
I am here. Can you hear me?
We can. The volume is not great, so please speak up, and it does help to speak a little more slowly than usual, just because of the technology. But we're glad to have you.
Very good. Thank you. I hope that's better. I took my earbuds out.
Boy, we can really hear you well now, Karen.
Okay, good. Good. Well, thank you for having me. I do have a slide deck to present. Adam, do you have that? If not, I'm happy to pull it up on the screen. I'm ready to go with that if needed. I'll go ahead and pull it up.
Go for it. There you go.
Okay. Very good. Sound and visual. I'm striking 100% today.
Perfect.
Good news. Okay. Well, again, thank you again for the invitation to be here. Very pleased to provide an update to the board. There is quite a bit of content here. I will do my best to speak slowly, however, to move efficiently through the content here out of respect for your time, so you can move on to other business. So again, we always like to start our presentations with a reminder about our mission. It's very simple and straightforward, and that is to improve the health and wellness of our members and their families. Here's the agenda. I thought it would be helpful for the board to be reminded of some important dates around Medicaid transformation. And then after that, I'm going to shift gears and provide some updates on some really great work that is going on internally at Cardinal. And you can see the topics there from our child program down to some work we have ongoing around our emergency department program. And then I have a couple new leaders that I would like to introduce to you who will be embedded in for sites as well as the Triad region in doing some great work there with our staff that is currently situated. This is a very busy slide. I apologize for that up front, but I do think it does a great job of illustrating the significant change ongoing in the marketplace right now related to Medicaid transformation. I think three important items I'd like to point out here, starting from the top and the left, really looking at the number of members currently situated with Cardinal Innovations. And on the far left there, you can see currently our membership is just over 485,000 members. As we move through the next couple months and transition into standard plan go live in July, on the far right-hand side of the slide there, you see our membership numbers shift significantly down to just over 53,000. Proportionately, this will be similar with all the other LME MCOs, as a good number, significant majority of members do transition to standard plans effective July 1. of this year. We are in currently open enrollment for the standard plans, and I'll show you more in detail on the next slide, but open enrollment for standard plans began in March 15th and it closes May 14th, so we are moving very quickly toward the end of open enrollment. Also interesting and important to know is that there is a tribal option plan that will go live at the same time as standard plans. This is for the Eastern Band of Cherokee Indians, and again, the timelines here mirror that of the standard plan. And then when we look at the foster care plan, that plan will launch in 2023. So the department is in the process of seeking feedback, continued feedback from our DSS directors, and based on that feedback, developing the plan again for launch in 2023. And then finally, on this very busy slide, at the bottom of the slide there, you see where we sit at Cardinal Innovation and our peer LME MCOs. We currently, the secretary, the department is currently reviewing RFA submissions with an anticipated contract award date of June. So again, we are almost in May, believe it or not. So we anticipate contract awards, like I said, in early June, with a tailored plan launch or go live the following year, July 1st of 2022. Important enrollment dates, I alluded to this just previously. I won't dwell on these dates, but it is important as you have constituents that are making this transition. Again, we are in the middle of open enrollment for standard plans. That period ends May 14th. And then after enrollment ends, for your constituents, our members who haven't chosen a health plan, they will be automatically assigned to a standard plan, and they will have 90 days once assigned to decide if the plan is a right fit. And then, as I mentioned earlier, standard plans go live July 1st of this year. Helpful resources here if you would like a deeper dive or a broader understanding of really everything Medicaid transformation. This is a really good, robust list of various resources that, that you can utilize yourself, or also please feel free to refer your constituents and colleagues to this information as well. The state has really, really robust website around this. I know Chantel and Dudley can attest to that. And certainly our website, Cardinal Innovation's website, is a good place to direct constituents as well. And as always, I'm always available, as is Kara, and you will meet her in just a few minutes here. All right, shifting gears to internal work here at Cardinal Innovations. Our child program is well underway. Really exciting changes here. We've been working very closely with our DSS leaders as well as a broad range of external stakeholders as we build this plan. Want to just highlight a couple pieces. Again, this is a March update, so this is not a comprehensive update of the entire child program, but a couple items that I thought would be relevant and important for this board to hear about during this presentation. And really, this revolves around what we're calling our site liaison program, our DSS site liaison program, or co-location, as it is more well known amongst our stakeholders. We have assigned licensed clinical staff to DSS offices for all 20 counties, 18 counties in our catchment area. And Forsyth was one of the first two to go live with this program. Leah Spare is the DSS liaison assigned to the county. And I asked Leah for some feedback on, kind of some real life stories and experiences that she has had as she has worked in this role. And because I think this really expresses where, where the impact really rests with your members and importantly with your DSS staff. So if you will indulge me just for 30 seconds, I would like to share this brief story with you. And Leah told me that she had been contacted by a foster care social worker who was trying to locate a therapeutic foster care for a child that had been placed in a respite setting after disrupting the family foster home that he was sharing with his younger sibling. And Leah's role here is really critical. She was able to work quickly with the social worker to locate an appropriate placement for him, worked collaboratively both with DSS as well as the provider to get the authorization approved quickly and get the youth transitioned and settled in to the new setting. A month later, he is well settled and well adjusted. So this is one of several stories that she had shared with me, and really this speaks, I think, volumes to the value of this co-location setting. So thought that it would be important for you all to hear that and hear that and experience that story. The final point on the child program expansion is around services. I'd like to draw your attention here to the Youth Villages box on the far right and the Intercept program. Intercept is an integrated intensive in-home parenting skills program, and it is an evidence-based program that is now available to all 20 of our counties. You'll see there in the box there that in Forsyth County, Youth Villages is serving 5 members. And the data here really are really impressive. This Intercept program has been shown to reduce the risk of out-of-home placements by 53%. The goal here is to keep the kiddos in their home settings because we know that outcomes are better for families and youth when that is the case. So thought, again, you would be interested in that story specifically with Youth Villages. And a nice segue from that program expansion is taking a look at our service expansion and enhancements broadly within our entire service area, and then specifically in Forsyth County. And from about a year ago, April 2020 to March of this year, we have added almost 700 services across the service area. 2/3 of those have been added since November of 2020. And you can see here what that number encompasses relative to new providers with new sites, as well as additional services. And then as we drill down and look at Forsyth County, you can see the numbers there. 48 services added in the county, with just over half of those added since last November. So making really, really good progress here because we do know availability of services is critical to meeting the needs of your constituents and our members. I'm not going to go through these next 3 slides. I believe you have this slide deck in your possession. This gets very granular, but I felt it important to include this level of detail should you have any interest or any additional questions around the specific services that have been added. And of course, if there is a gap in the data and you would like more information, please feel free to reach out to me and we can certainly provide that. Same thing here. All right, emergency department update. Really excited about the work ongoing here. What you're looking at here is all specific to Forsyth County, really bolstering our efforts around our emergency department strategy and our collaboration efforts. Specific to Forsyth County with Wake Forest Baptist and Novant Forsyth Medical Center, around ED Peer Support Specialist Program. The metric we will be following there, or the goal, is to identify providers who can have a response time in less than 90 minutes. So that is our baseline criteria for that piece of our strategy. The second bullet there is around the ECR program and Spark. And we are convening a meeting with Wake Forest and Spark to introduce the ECR program. And why I'm excited about this program simply is because of the efficacy that Spark has experienced through this program and looking at really reducing length of stay, if you will, and ensuring that youth who present at the emergency department are connected to supports and services. So specifically, this program is designed to put intensive clinical supports in place for youth with complex needs who have discharge barriers from hospital or facility-based crisis settings who are in DSS custody, in a DSS placement and at risk of presenting to the emergency department, and who are in mental health crisis. So this is a really, really impactful program, and looking forward to our partnership here with Wake Forest in rolling that out. Also working with our Highland Avenue, not ours, but the Highland Avenue BHUC on serving low acuity non-emergent members. And a lot of other work going on. It's a very robust program. If I have the opportunity to be with you again, I think this is really worth, and Chantel will talk more about this comprehensively as well. A lot of metric-driven work going on collaboratively with Novant and Wake Forest around emergency department. And last but certainly not least, this is the world I live in community engagement. Wanted to give you just a few highlights of the work ongoing. I am not going to read all of this content. This is a very busy slide. Just wanted to point a couple things out here. And then I would like for my two new team members just to have a very, very brief opportunity to say hello to you, so you can be initially introduced to them. So the couple points on this slide that I would like to point out are under current points of engagement and then highlights. The first is around our engagement with Forsyth County law enforcement, as well as the Winston-Salem Police Department, specifically around crisis intervention training. Some of you may be familiar with this program. In fact, there is a CIT training ongoing this week with Forsyth County Probation. And we have a long history of engagement with local law enforcement, very critical. And this is a collaborative effort between NAMI Northwest, MHA of Forsyth, and as I mentioned earlier, the Winston-Salem Police Department. And then finally on this slide, I'll draw your attention down to the highlight section. The second bullet there is around our Narcan program. As part of our larger opioid initiative and our ongoing commitment to support of the health and wellness of our members impacted by the opioid epidemic, we are offering support in distribution of Narcan. When we facilitate this through the Public Health Department in Forsyth County, in fact, Chantel and I spoke about this just a couple days ago, we have distributed, I believe, 540 kits to the County Public Health Department for distribution to community partners, EMS, police, and other interested and appropriate parties. So very pleased to participate in that program and offer that resource. The next slide here, again, just high level. This is just to share with you, there's a lot going on, broadly within our service area, but very specifically in the Forsyth area. I have a new director of community engagement whom you will meet shortly. And it's his purview to lift all of this work off the ground and really bring it to the forefront. So you will have really great awareness of how we are engaging locally in the Forsyth County area. And finally, and want to be sensitive to your time, I did want to introduce Kara Townsend to you. She is my new Regional Affairs Director for the Triad region. Really great background, most recently with the U.S. Census Bureau. And her primary responsibilities will be working very closely with you as commissioners, as well as with Chantel and Dudley in really ensuring that your needs are met, that she is communicating those needs back to us in Cardinal, and that we are solutioning and getting information and resolution back to you in rapid fashion. Second leader I'd like to introduce is Jonathan Clark. He is the new Director of Community Engagement, recently joining us about a month ago. I want to be sensitive to time, so Kara, give us 15 seconds. Jonathan, give us 15 seconds, and then I'll put a period at the end of the presentation. And if it's the chair's preference, I'm happy to open it up for questions. Kara, can you introduce yourself briefly, please?
Good afternoon, Commissioners, and hi, Chantel. My name is Kara Townsend, and I'm happy to be here. I come with about 20 years of experience in public policy, having worked in Congress for a president and also the North Carolina governor. I'm very passionate about a lot of the issues you deal with, primarily in foster care and trafficking. I know that was in Karen's presentation as well, but you know, we know that North Carolina ranks 10th in the nation for human trafficking, and 60% of those victims come from the foster care system. So I hope to work with the county and helping educate and find creative solutions to educating these kids in the foster care system, and also being a resource for you on all things Cardinal related and how to make our care and the delivery of that care spectacular. So thank you for having me, and I look forward to meeting all of you.
Thanks, Kara. Jonathan, can you give us a quick intro?
Sure. Good afternoon, Commissioners. My name is Jonathan Clark. I am new on board here at Cardinal as the Director of Community Engagement. I look forward to engaging throughout the Forsyth County and with all of the stakeholders. People is a true passion of mine, and I come from about 11 years of experience in strategic partnerships and business development. So I'm happy to be here, look forward to working with each of you, and thank you again for your time.
Thank you, Jonathan. Thank you, Kara. And Commissioners, thank you very much. I hope you've heard from this presentation, although it was brief and high level, that we here at Cardinal remain deeply committed to serving our members in the Forsyth County area community, and we want to continue to serve them for a long time. We know that you are currently receiving public comments now around disengagement, and hope that after hearing from the public, of course, we hope you decide not to continue disengagement. However, if you do, we rest assured in knowing that we continue to be committed to helping our members understand the transition process as we move forward based on the decision. So again, thank you for the opportunity. Happy to be here. And Chairman Plyler, if time allows and it is your desire, I'm happy to take any questions.
Thank you, Karen Bentley. Commissioners, any comments or questions for Karen today? Good opportunity. Commissioner Linville? Well, Karen, I think you made a good enough presentation. Everybody seems to be very happy, and we're just delighted that you are here with us today, and thank you so much for a very interesting and comprehensive report. Now,
thank you for the opportunity.
I would like to mention that we have another report, a discussion item coming up from Chantel Robinson dealing with the behavioral health budget. But before we go with that, let's get a report from Joshua Swift, who is the director of the Forsyth County Public Health Department. COVID-19, the virus, where are we? Good news, bad news? You're on.
All right, good afternoon, Commissioners. Thank you for having me. The COVID status update, we have a total of 34,753 cases since the beginning of the pandemic. But I will note our last 14 days, we've had 1,030 cases. And this is an uptick. We're averaging now 74 cases per day. 2.5 weeks ago, we were averaging 45 cases per day. So we are seeing an upward trend, and I'll have some more details about where those cases are coming from in a few slides. Our total deaths since the beginning of the pandemic is 370. So when you look at the number of lab tests and the number of cases since the beginning, you can see at the far right of this slide that we have seen an uptick in cases in the past 2 weeks, as well as an uptick in testing because there's more demand for testing because more people have COVID or are having symptoms. Next, you can look at the number of new cases per 100,000 across the county over the last 14 days, and this follows a trend of increased cases. So this is increased case counts and incidence rates, and you can see that the numbers are going up, where we were at an all-time low in late March, early April. Over the last few weeks of April, we've seen started to see an uptick in the number of cases. The next slide shows our percentage of COVID tests that are positive during the last 14 days, and that number also is going up over the month of April. Next, you can see where our cases are coming from. You can see that over the last 2 weeks, starting in early April, that our cases have been driven by individuals in the 15 to 24 year age bracket, with next being those 25 to 34. So those 15 to age 34, and then the third highest rate is among 35 to 44 year olds. So this is the group that you'll see in just a second that are the least vaccinated. If you look at the number of cases among older adults, those are very low. Those cases are now very low, and I think that's proof positive to show that the vaccine is working in those populations, because they have a high number and high percentage of people that are vaccinated. But this is our drive going forward, is reaching individuals, young adults, teens, 15 to 24, 25 to 34, and 35 to 44. That's our biggest focus. You can look at the number of residents who are hospitalized. This number continues to stay about the same in the 30s and 40s. We've had a decrease, which is a good thing, over the past few days, but it's stayed pretty level over the past few months. Next, the number of vaccines that have been administered by the Forsyth County Department of Public Health. You can see we've administered 85,602 total doses, and 47,201 individuals have completed their series, which means they've had either both doses of Moderna or Pfizer, or they had the dose of Johnson & Johnson when we had those special events. So the number of Forsyth County residents who are fully vaccinated is now 110,617 individuals, which is 28.9% of the population. You can see the numbers on the left that show that by the age groups, and you can see the right by race. Again, as I just stated in the previous slide, when you look at by age groups, you can see that our younger population, our younger adults, are less vaccinated. And that's where our focus is, whereas individuals in the 50s, 60s, and 70s are much more vaccinated, 68% in the over 65, and then 71.5% of those 75 and over. When you move to the race, you can see that 19% of African Americans in the county are fully vaccinated, 29% of white residents, and 14% of Hispanic residents. We believe that the uptick in our African American and Hispanic numbers are directly a part of outreach that's being done by not only the health department, but by Novant Health and Wake Forest Baptist Health into the community, doing special events, outreach events, and pop-up sites that are targeted to the African American and Hispanic population. This next slide is individuals in Forsyth County who are vaccinated with at least one dose. You might hear some people say partially vaccinated. So that's 147,747 residents, which is 38.6% of the population. So again, that's 38% of the whole population, including all ages, and I'll have some more clarification on that in a moment. But again, you can see when you look at our older population, you know, the majority of individuals 50 and over, all age groups 50 and over, have gotten the vaccine. 80% of those 75 and over, 77% of those 65 to 74. But again, we have work to do in the 18 to 24 year range and the 25 to 49 year category. When you look at the breakdown by race, 25% of African Americans are partially vaccinated, 38% of white residents, and 21% of Hispanic residents. So the next slide, and this is my last slide, we've took the data that I just shared with you that showed the number of residents that are partially vaccinated, and we teased out the number of residents who are under 18. So right now, the only people under 18 is only available for 16 and 17 year olds. We do believe that Pfizer will have the vaccine available, be approved for those 12 and over pretty soon, and we're working with the Winston-Salem-Forsyth County school system to gauge interest in the vaccine among middle and high school students. But when you tease out the number of those that are over 18 and over that have been partially vaccinated, with the population of Forsyth County that is 18 and older, 50% of Forsyth County residents over 18 and over are partially vaccinated. So I think that is a awesome statistic, but we still have a ways to go, especially when you look at Governor Cooper's announcement yesterday and that push to get us the state to 2/3. So 66%. So we still have a ways to go before we can get to that 66% of our residents 18 and over who are partially vaccinated. And it's really going to be dependent on those young adults, 18 to 24, in the 20s and 30s and early 40s, to get the vaccine and get partially and then fully vaccinated. Ways that we're trying to encourage that, we are doing, we have walk-ups available at our clinic at the fairgrounds. So we're trying to make that more accessible. You can still make an appointment to get the vaccine, but we're also allowing walk-ups. The way we do walk-ups, we have our clinic today at the fairgrounds from 1 to 8 p.m. We're offering later hours, but also we're offering walk-ups until 1 hour before closing. So you can walk up anytime from 1 to 7 p.m. At our fairgrounds today. We also have, you can see the hours for this Saturday from 9 to 11. The total clinic is open from 9 to 12. You can do walk-ups on Mondays and Tuesdays as well at our clinic at the fairgrounds, as well as you can go online now to forsyth.cc/COVID update and make an appointment as well for those dates. And again, going forward, the key is young adults. And I think it's not only this, obviously there's some hesitancy, but also creating that urgency. I think there's a lot of individuals who are like, I'll get it later, I'll get it later. We have vaccine that's available now, and we have the staffing and the facility where we can do that. So we're wanting to make that known, and we're also continuing to market to our population that is 40 and below to make sure they know, and we know that's going to be a different marketing than we had early on to our whole population. We're trying to target our marketing to a younger demographic and make sure they know how important it is to get the vaccine and how easy it is to come and walk up and get the vaccine. So that concludes my presentation. I'd be happy to take any questions.
Good news and some bad news from Joshua Swift. Commissioners, do you have any comments?
I do.
Commissioner Ted Kaplan.
Joshua, when I was a kid, and it goes a long way, we used to get this when they were giving the polio vaccine, you went through and you got this little sugar pill or something at school, and all the kids lined up and we got this little thing and had it. Is there any thought of the health department going into the high schools, not all at once, but on some sort of schedule? And I know Daryl's here now, but is there some thought about doing shots at the high schools?
Well, we have, that has come up, and we have talked to Tricia McManus about just looking at the possibilities. And right now, we're trying to gauge the interest. We would really like it to be available for the 12 and above, so that way we could hit everyone in the high school and possibly most of the middle schoolers as well. And we're wanting to really now see what the interest is, to see if at this high school, which has 2,000 kids, are there 700 or 800 that are interested, or is it just 70 or 80? And what the interest is in the vaccine, and then we can respond appropriately.
Wouldn't that decision have to be made by their parents under the age of 18 and not so much the child?
Yeah, it would be actually be under 16 and above per the general statute could make that decision, but we're sending a survey. We're working with the school system to survey the parents to gauge that interest now.
So they are going to do the survey?
Yes.
Great. Thank you.
Additional comments or questions for Joshua Swift? Joshua, thank you very much for the report. It was well-timed, and we got the good news and the bad news with it. Thank you again. We've had a discussion today from Cardinal Innovations from Karen Bentley, and we've just heard from Joshua Swift, who is in charge of the Forsyth County Public Health Department. Now, with an update on both agencies, but not the agencies themselves, but the subject matter, with a report on behavioral health, is a discussion from Chantel Robinson, who is the Deputy County Manager. Chantel, very informative, a lot of information coming out. What do you have?
Yes, good afternoon, Commissioners, and thank you for having me this afternoon. So today I'm going to be discussing the behavioral health funding recommendations as part of the fiscal year 22 budget. And so just a quick reminder on the North Carolina general statutes that the county is responsible for appropriating funds for the support of behavioral health programs. There's really no exception to that. We are not allowed to reduce appropriations unless there is some sort of across-the-board reduction to all county departments. And so the primary funding sources for mental health, substance abuse, and developmental delay funding is Medicaid, state funds, local allocations, which is the county money of $4 million, and then other sources, private insurance, Medicare, and private pay. And so this year, our allocation process, we did release a request for proposal on February 4th. Applications were due March 5th. And then the priority areas for those are listed here, and that is what we seek proposals for each year. So we do have an allocation committee that includes 3 members of the Health and Human Services Board, and that is Pamela Corbett, who's the psychologist capacity on the board, Sharon Ream, who's a social worker, and Dr. Linda Petru. And then staff provides them with support as they may need. And so we had Kimberly Boosie from the Budget and Management Office, Amber Humble, who's the Stepping Up supervisor and has worked with both Centerpoint and Cardinal in the past, Denise Price, Assistant Public Health Director, who's also worked at Centerpoint and Cardinal, myself, and Kyle Wolf, the Budget Director. And so the committee did meet and reviewed the proposals and provided recommendations to the Health and Human Services Board, who voted on April 5th to forward recommendations to the county commissioners for your consideration. All of you should have in front of you a handout that Ashley Sloop passed around, but essentially what I'll do is go through what the requests were and the recommendations from the committee. And so Mental Health Association provides crisis intervention training crisis intervention team training, and they were requesting $25,000, and the committee does recommend that amount. Horizon Center was requesting respite services for the IDD population of $40,000, and the committee is recommending that amount. Monarch was requesting $200,000 for their 651 program, which is a program that serves adults with IDD in the amount of $200,000, and the committee is recommending that amount. Financial Pathways was requesting $30,000 and has received $30,000 in the past. The committee was recommending $19,800, and the significance of that was a follow-up question from the committee to Financial Pathways was what percentage of the population they serve are Forsyth County residents, and they said it was 66%, and so the committee was recommending 66% of the $30,000 they were requesting. Daymark, which is an anchor provider, they do our behavioral health urgent care as well as have a walk-in clinic, and they also provide transportation to individuals for healthcare appointments or emergent appointments. They were requesting $1,027,425. The committee recommended $1 million. And the reason for that decrease actually was in order to balance the budget, and then you'll see at the end it ended up not doing that anyways, but the committee felt that they, of all of the organizations, could decrease a little bit and not be significantly affected. Monarch was requesting $62,300 for behavioral health outpatient clinic, and the committee is recommending $62,300 for that service to provide another option to residents for behavioral health needs. They do serve a very large low-income population. School Health Alliance was requesting $83,199, and the committee was recommending that amount. They do provide school-based health and mental health services in the schools, and last fiscal year they served 1,271 unique individuals. NAMI was requesting $9,000 this year. They previously were funded at $6,000. The committee recommended maintaining them at their current funding level of $6,000. NAMI does provide family support groups and peer support classes, various trainings and education support for individuals and their families experiencing mental illness. The YWCA Holly House was requesting $128,390. The committee recommended $25,000, and the $25,000 would provide $20,000 of special assistance fund for the women who complete their program that would assist them with transitioning out of their transitional home at an average of $1,000 per person for rent, utility, and furnishings. Holly House is a 6 to 9 month residential program for women with substance abuse. The committee did not want to fund the full amount, primarily because the county has provided substantial funds to Holly House in the past for renovations, and they stated at the time that they had the capacity to staff it and to provide the operations that is needed. The majority of the additional funds they were requesting was for operational support, and so there was concern about the financial sustainability of the program. Green Tree requested $224,000. We're currently funding them at $35,000. The committee is recommending $45,000 to continue to support their peer support program. They were also requesting additional funds for their refuge center. There was a lot of discussion, a lot of great work being done by Green Tree, but there are some concerns about the financial sustainability of that organization as well. And so there will be conversations with Green Tree just in regards to the operational structure of the organization, but we certainly support what they are doing and what they are trying to do for our community. Cross North School requested $198,000. The committee is recommending $198,000 if they do not receive funding for a SAMHSA grant. So on your slide, you have $0, but there is a notation that if they do not receive the SAMHSA grant, the HHS board would recommend funding their program. And it is for trauma-focused therapy for children and families, really trying to build a trauma-resilient community, school-based therapists, and it really is an evidence-based program. However, the commissioners approved a couple months ago a application to SAMHSA for the county, under the county, but we would be subcontracting to Cross North School for almost $1 million. And so this seemed like a duplication of funds, and we did not feel comfortable funding both when we told the federal government that there is no such program in Forsyth County. And so we may, if the board recommends this, these recommendations, if they do not receive the SAMHSA grant, we may come back and want to pull our behavioral health budget reserves to fund that item. Family Services requested $147,895. The committee is recommending $60,600. This is for trauma-focused therapy. We were not interested in funding the full amount. The $60,000 would cover one full-time equivalent of a therapist. And then there were also some concerns about the overhead cost in general, but $60,000 would give one therapist, which we do feel like the community needs enhanced trauma-focused therapy. DSS submitted a request for a substance abuse therapist in the amount of $75,000. The committee did not recommend it. We actually just informed DSS if they're interested in that, they need to submit it through their normal county budget, not through the behavioral health funds. Hope Counseling and Consulting requested $500,000. The committee is not recommending funding this program. This is for transitional housing, but in general, this application, it was just a poor application. It seemed very much like a startup organization. There was a lot of discussion about the lack of financial sustainability. Certainly, we support what they are trying to do, and they can submit an application again in the future. Novant Health Foundation submitted an application in the amount of $179,304, and this is for a program, medication assistance for uninsured patients. There was a lot of discussion about this particular item, but ultimately the HHS board decided not to fund any of it. They felt like Novant Hospital could assist with funding the uninsured patients, although this is the Novant Health Foundation, but the committee ultimately decided not to recommend funding. Moji Coffee requested an additional $15,000 for this upcoming fiscal year. The committee recommended not funding the additional amount, but you'll see in my next slide, this looks like it went back, sorry. You'll see in my next slide that Moji Coffee is carved out, and so they are still receiving funding. We were just not recommending an additional amount. CareNet Counseling requested $75,000 for a full-time therapist, and the reasoning that the committee did not recommend this particular request is because of the low number of people that they said that they would serve in the application, and there was also no clear sustainability plan. Smart Start requested $391,000. And the committee did not recommend this, and the main reason is that it was a late application, and we cannot consider late applications, or we do not. And then the next slide is our carved out programs. And so the committee did not recommend any of the carve outs. These are initiatives by the Board of County Commissioners, and certainly you can decide if you want to continue funding them. But we do have Cardinal Mental Health, First Aid, Suicide Prevention Training in the amount of $25,000, and that is for training for county employees. The Faith Health Chaplaincy Program in the amount of $75,000. That's the chaplaincy program that services the Sheriff's Office, first responders, as well as other county employees as well, all county departments. Moji on Trade Street, you can see, is at $15,000 this year. They were at $30,000, but that is because the agreement with them has been a gradual decrease over the years, and that was intentional in their contract for financial sustainability. And Moji Coffee, the same, they are being funded. Moji at the library in the amount of $33,734 is being recommended. The County Stepping Up program at $515,000. Public Health's Polysubstance Health Educator, this is primarily to combat the opioid epidemic at $60,000. The Community Paramedicine program at $754,000. For DSS, this is money that is used for foster care and adult placements, and primarily these funds are used when the LME-MCO is delayed on authorizations or denies authorizations. So it's for placements that we put in the budget to assist with that. The WellPath Vivitrol injections, ARCA Vivitrol injections, and Insight are all part of the district attorney's program. And so this is a pilot program. What we are recommending continuing it for this upcoming year, but we do want to assess the success of the program after FY22 to make sure that it is still doing what it was intended to do. Check the statistics, how many participants, what does recidivism look like, all of those things. And then we also fund the IDD advisory committees and mental health substance use committees, total $30,000, so it's $15,000 each for those. And then the Sheriff's Office mental health professional of $92,408. And on my next slide, you'll see when we talk about if we want to use any behavioral health dollars for the behavioral health unit at the detention center, we can certainly, we can use part of those funds as well. Does anyone have any questions about the recommended programs before I just talk about our behavioral health reserve?
Questions or comments for Chantel Robinson?
I've got a big picture question.
Yes, sir.
If I added all this together, and I may not have added it exactly right, but it looks like the total amount in this this maintenance of effort, is about $4,026,000, something like that, some odd dollars. Is that the exact number? That's adding the reserve, it's adding your total from your 2 pages plus the reserve, and I'm getting that kind of number. Is that the total amount we've got?
That is correct. So the total allocation is $4,026,077. So that would be for the recommendations from the committee, and that's in the total amount of $1,626,899. Then plus the carved-out programs is $2,218,725.
And that's that number that is the maintenance of effort, to maintain that maintenance of effort piece of it. that-
Yeah, my memory was I knew it was less than 5 million, but I thought it was kind of between 4 and 5, somewhere in the 4 and a half. But maybe my memory's bad.
Yep, it's $4 million. That is correct.
Additional questions or comments?
And then I just have, my last slide is to talk about our behavioral health reserve. So we do have a fund balance in the behavioral health funds. It is comprised of funds that have been unspent each year. So, most of these programs, so for example, if Stepping Up in the community paramedicine program, if they have any vacancies, then that is money that's not spent. And so any money not spent for any of these programs ends up rolling into the behavioral health reserve. And so our total reserve for, as of June 30th, 2020 is $3,427,900. Now, what is actually available for appropriation is $2.3 million. $615,000 of that is for public health pharmacy. We don't think we're going to need that this year, and it's probably something we may not need next year as well. But that was to try to keep the public health pharmacy whole because they primarily provide prescriptions for behavioral health services. So the available balance at this point for FY22 would be $1.695 million if we end up needing the $615,000 for public health. Now, there is other fund balance that's appropriated currently of $1.1 million, and that is the remainder of the ARCA project of almost $1.1 million of the renovations for that facility, and then we have $20,000 that's encumbered from OG Coffee at the library. And so, we are looking at some potential upcoming reserve projects, but certainly subject to the board. We discussed last week about the behavioral health unit at the detention center. If that is something that the board is interested in doing as a one-year pilot program, we could certainly use behavioral health reserve money for that. That would cost $329,000, and we could reduce the $98,000 we're currently giving them for the one mental health professional right now through the WellPath contract. We are looking to upfit the second floor of Highland Avenue Center at some point. The price of that can certainly fluctuate depending on construction, anywhere between $1 and $2 million. So I put worst case scenario. Right now, that structure is completely unfinished, but we know that the needs in the community at some point will need that space for community behavioral health, substance abuse. And as we know, we'll be getting, hopefully soon, an opioid settlement. We may need space for programming for that. And then we also talked about possibly needing a therapeutic group home for DSS emergency placements. We've been talking to various providers to see, if we were able to provide some sort of property, what would it cost for them to run it? What would startup costs be? And those types of things. And so we are exploring those options as well, as we know we need to find placements for our DSS youth.
Yeah, could I ask you, that explains a lot, because your budget reserve figure on these 2 pages we have is just what's left over out of the $4 million that you're looking at, which could be that part of it could go to wherever you said. But it would be, what you just described in the whole history of the budget reserve piece, it'd be nice to see that on a piece of paper, because there's a lot of numbers there about what's set aside for this, what's set aside for this, what are possible one-time expenditures, to get a kind of a flavor of what that looks like. And I'm kind of curious how this is about year 3 we've done this, 3 or 4 that we've been doing this, more? 5?
You mean the maintenance of effort?
No. Yeah, well, no, we've been doing maintenance efforts a long time. But it's really, I guess, since Cardinal started, we had discretion over our maintenance of efforts money.
That
I
is
think
correct.
that discretion time is running maybe 4 or 5 years. I'm kind of curious at what rate has that budget reserve accumulated? And I'm just about where the original 3 million came from, and how long did it take to do that, and how much, it's kind of like how much slippage is occurring in each of these each year. And obviously, it could be, just like you said, people, and I would think that maybe, I don't know how the pandemic may have affected it or not. But it would be, I'd be a sheet of that describes the budget reserve, kind of how it's accumulated, what it's been used for, just some kind of little summary, and then these potential projects from that reserve would be interesting.
Okay, I will definitely get with the budget office to assist with that.
Yeah, and part of those are a function of a few programs that we've got that where the uptake of the dollars are unknown, like the data program. You know, we budgeted a level not knowing how many people would come through that program. The pharmacy is similar to that. The DSS foster piece is similar to that. And so, and to your point, we are getting to the place where that's more predictable now.
Mr. Chairman, Chantel, I'm very interested in the pilot program for the detention center for the behavioral health.
Yes, ma'am. And I know Randy will be on for the briefing session, and so he can certainly update the resolution if that is the board's wish to add that to their contract.
Thank you.
You have answered a lot of questions and given us a pot full of information. We have any further comments or questions for Chantel? Deputy County Manager, we'll go from the deputy to the county manager. Dudley Watts for the completion of our agenda.
So we'll go ahead and dive into finalizing our May 6th meeting agenda.
Have you got the May 6th agenda?
Wait, could I just, one second, could I ask Ashley, my thing's not coming up, the May 6th agenda.
Mine's not.
I'm still stuck on April 22nd.
I am too.
What's that?
Yeah, we had an issue with that because the link, I had that same problem, which is why I walked over to our clerk. The link is not working. What do you think we need to do? Ashley, can you forward an email to every commissioner right now with that link? She's going to forward you the right link. For whatever reason, that static link we have is. Yes, sir.
Yes. Do you? Mine says April 20th.
Mr. Kaplan, I believe you're looking at the new agenda system.
I went to the new agenda system, didn't have it. The May 6th is not in the new agenda system, just had April meetings. I went to that.
In the new agenda system, if you click on the April 22nd link,
Yep.
not the special meeting.
Yeah, I know, that's the special, that's the board, the special meeting, but the next one below, is that it?
That's it.
How come it hadn't popped up? Oh, there we go.
It would be nice to have the
Got it.
Jeopardy
Got it.
jingle right now.
I got it.
You got it, okay.
Good?
You know what would be helpful, Ashley, is in the labeling of those things, if we tied on instead of having April 22nd on there, it had May 6th.
I'm getting there.
Because it, on the menu, it says April 22nd. I realize that was the briefing part, but it looks like even if it said for the May 6th, then the May 6th would have been on there, on the cover. You understand what I'm saying?
I understand
Kinda
what
like
you're
the
saying.
title, yeah.
All right. We're off, ready to go?
We're off and running, County
All right,
Manager.
very good. All right, so we'll dive into these items for May 6th. The first two parts of that, the old business part of that is the carryover items due to the fact that they required a public hearing. So unless I hear it separately from you or that you want me to go into those, we'll dispense with that. dive into item 3, which is the public hearing in connection with the financing of airport facility, KALEIDEUM, and airport projects, and the refinancing of the current debt obligations. Lee Plunkett reviewed that. He is on the line, or Paul Fulton is on the line if you have any questions on that.
Not a one.
All right. Item 4 is a public hearing to consider the expenditure of county general funds for an economic development project and authorizing execution of an agreement with a company, and that is the headquarters and manufacturing plant. And actually, item 5 is also a similar resolution regarding the expenditure of economic development project funds. As I understand it, and Kyle Haney is in the audience along with Mark Owens, that we'll be able to announce the names of that as we head into the meeting on May 6th, but not until then.
Any comments or questions?
All right, very good. Item 6 is a resolution recognizing May 2021 is for Foster Care Awareness Month. John Thacker will be here to accept that resolution. Item 7 are approval of minutes for the meeting of April 15th, and they are
We're working on it. They haven't
working on
gone
it.
out yet.
Okay, so my suspicion is they'll at least be out by next Wednesday, which is sort of our normal deadline. Item 9 is a resolution approving a contract for the purchase of a DS-450 central count tabulation scanner for use by the Forsyth County Board of Elections. Tim Suji reviewed that. Any questions?
Questions? Not a one.
Item 10 is a resolution authorizing execution of a contract between Forsyth County and Media Placement Services to provide advertising and marketing for testing and vaccination efforts related to COVID-19 at the Department of Public Health. Adam Pendlebury reviewed that.
Questions?
Very good. Item 11 is a resolution awarding a contract for inmate health care delivery services for the Law Enforcement Detention Center. Randy Hounsucker reviewed that last Thursday. We are working on some analysis and really kind of follow-up regarding the issue of the TPA administrative cost. Commissioner Martin brought that up, and we are working towards whether or not there's some ways to make that a little less expensive, something we had dealt with actually a number of years ago, but we're trying to do that analysis, and we'll have that for you, and we'll be able to hopefully have a recommendation, but I don't have anything today on that. Mr. Martin?
Comments? Questions?
Go ahead.
Go
I got a
ahead.
question, but someone can go first. Or no one else has a question?
No, I don't think so.
Just on that proposal, total, I had a chance to study the PowerPoint that we had a little bit more, and this is just kind of an observation. I'm still a little concerned that the mental health availability on the weekends is still pretty slack in terms of hours. I think it's 8 hours per day on the weekend, and not that there needs to be somebody there 24/7, but I'm kind of curious I'm just kind of curious what the thinking is on that, and there's a piece of there was a 4/10 of a person that was basically a psychiatrist that was actually listed in that proposal, that we were currently doing something like 4/10, and now this proposal is like 2/10. And I'm sort of, are we getting any real, it seems like what we really need is somebody that can be on call, that you pay like a retainer to, and then you pay them an hourly fee when you need them. And that would, I realize this is a part of the RFP, that's why I'm making sort of an observation, but it just seems like we've had a lot of concerns about mental health support, and the psychiatrist piece, which is your kind of the top level, is pretty slim, and it seems like we really need consultative help that we just pay for whenever it's needed, something like that. That's just an observation. The whole trying to fix the thing, that would be something to take a look at. And I agree with Commissioner Wisenhunt that I think the reserve, kind of that add alternate for the mental health thing, is a good thing to do. I think we ought to try to do that. I don't know if it's. I read the requirements for all that we got this week for the backgrounds of the folks, and I think the licensed care social worker, the ones that are assistants, associates, or whatever they're called, I hope the numbers on that are small, and that's because they ought to be a whole lot cheaper people. And I'm just kind of little concerned about the training of all the staff pieces on those LCW, licensed care LCSWAs that are on that list. So anyway, I just the rest of it seemed to be a good beef up on the nursing care and that part, and I think those were answering a lot of the needs and issues we had. So, I mean, generally speaking, there's a lot of work on that, and I really appreciate all the work done on that. I just still have got a little concern about kind of generally about the mental health side of it.
And I'll follow up with Randy Hunsucker at the Sheriff's Office on that and with budget, and we'll come up with something for next week's resolution.
One question, Mr. Chairman.
Commissioner Fleming Elamine.
You also want to support the behavior allocation for the detention center, but I had one question. The vendor will not support the behavior clinic at all?
So the vendor will provide the service, but they're asking us to provide the funding for the service. So it is NAFCARE, and so it's an additional option if we wanted to add more for behavioral health. So they have a baseline that Dr. Novichok mentioned last week when she was explaining it, but this would be to enhance those services. And it sounds like you want to even, beef up the baseline a little bit more as well.
Or to think about, this is what struck me looking at that staffing chart, is that Monday through Friday, if you do that alternate, Monday through Friday, you've got all kind of help. I mean, day, night, and everything. And on the weekend, this is pretty slim. And I'm thinking, in terms of mental health issues for inmates in the jail, that's a 24/7 issue. It's not a 5-day-a-week issue. And so I'm a little surprised. I mean, I probably don't like the way the resources are being allocated, because it doesn't seem to me it's covering the weekend much better than we're doing now, which is nothing now, but as I understand it. So that's just
So we'll get
overall
clarification, but it's definitely our understanding that this would be providing additional staffing on the weekends, but we'll revisit the chart and we'll get clarity with NAFCARE before we bring the item back next week.
Thank you.
Final question there, Mr. Chairman.
Sure, right ahead.
So after the pilot program for a year, what's the thinking beyond that?
At that point, I think the board will need to decide if it's something you want to continue funding out of county funds, if that's something that we want to continue considering out of the maintenance of effort funds, and the success of the program. So I think after a year, we'll just have to be at a decision point.
One more follow-up is, do we have good benchmark data to help sort of evaluate that? I mean, in terms of, when we haven't had a whole lot in the past. I'm trying to decide if we know whether we're better or worse at the end of a year of trying this out.
So I'll have to get with Dr. Novichok on that, but her sole job as the jail health monitor is very data-driven on all of the types of mental health cases and all of that. So I absolutely think we'll be able to show something.
Part of that was in that PowerPoint too. So I say if that's quantified, you'd be able to take a look at it.
Were you thinking of something at this point to say? Oh, that makes sense.
Ask him if he knows this guy.
I do think it's important to remember that, that our average length of stay usually is around 25 days. And so what you really hope you can do, and I think that the program that they're offering does this, it's really what you do in follow-up to try to get somebody into resource referral after they've been in the jail is probably the most important part of it. But I mean, clearly the sheriff's interest in that mental health program is really around being able to manage those inmates better while they're there. So there's sort of two parts of it. How do you manage the behaviors and the substance abuse and the condition that they land in jail with, which is tough, and then but in terms of metrics around, they're not going to be there long enough for a metric around, how well was their mental health.
I do understand that.
Yeah, it's just
that piece, but the data we saw in that chart, it's coming back to me, was that it was just numbers of like people needing services.
Right.
But there was no real as you would not expect in that chart. But I think the real is kind of what is that ebb and flow? What does it look like? What are the nature of the services that are needed? The managed behavior, providing quote-unquote treatment, suicide intervention.
Right.
You know, what those things begin to take a look at and see how you do it.
Yeah, I mean, I think the expectations after the pilot's over is going to be, the real metric is going to be after somebody spent some time in the jail, they got out in 28 days or whatever, is there a way to follow them? Did they get into services? And, you know, did they reoffend as a result of that? And I think the other metric would be how safety in the detention center for both staff and inmates as well. So,
Which could be some survey data, kind of to get
yeah,
at.
I mean, I
particularly
can
on
tell you
staff
how
side.
many. I can tell you how many inmate altercations. You would be shocked to know how many inmate altercations we have in the jail.
You probably wouldn't be sure. Yeah, I got you.
And we keep that data, and so being able to keep that data and sort it around the mental health population that we put in there would be helpful, I think. So there's a lot to it.
Well, you know, the final item on the agenda, item number 15, I know Commissioner Kaplan is excited about it, and I'm excited about it, so you've saved the best for last, right?
Okay, well, I'm going to jump just real quickly, make sure there's not any questions on item 12 and 13, which are our two property matters. Chelsea Swain reviewed those. I think we're good there. And then you do have the appointments there, 3 appointments to work through. And then that last item, item 15, which is that resolution authorizing execution of necessary documents to accept a United States Economic Development and Administration grant, or EDA grant, for the 2020 Public Works and Economic Adjustment Assistance Program to support Smith Reynolds Airport. We added it due to some timing things that Kyle Haney will review. So, Kyle.
Good afternoon, Commissioners. Like the county manager said, we were notified of receiving this award back on April 8th. The federal government requires us to respond and accept it within 30 days, which is why we're walking it in on the second briefing. But just to brief you on the item, back in September of 2019, the board authorized county staff to apply for grant funding from the U.S. Economic Development Administration to support Smith Reynolds Airport, specifically 4001 North Liberty Street. That's the building that North State Aviation operates out of. We were eligible for the 2019 Economic Adjustment Disaster Recovery Program due to Hurricane Michael. So the staff put together an application, submitted it. We were notified earlier, or in 2020, that we did not receive funding for that application, but they requested we reapply or apply for reconsideration under some additional funds that came through the CARES Act. We were then notified back in April 8th that we did receive that. So it would provide $4,450,677 towards repairs to that facility. The county is required to put in $1,617,338 for those repairs. The board had already appropriated that money as part of the 2019 capital projects ordinance. And so there are some associated budget ordinance amendments that would move that to the Smith Reynolds capital project ordinance. And then this item would allow us to accept that grant. Happy to answer any questions.
Questions or comments?
Thanks for doing the paperwork. Thanks for submitting the info.
Well, sorry, I couldn't hear that.
What?
He couldn't understand you.
Oh, I'm sorry. I said thank you for submitting the grant and doing the paperwork.
Absolutely, we're happy to do it. Happy to support Smith Reynolds any way we can.
Sorry, I had mask mumbled.
Further questions, comments? Thanks.
All right. That is all we have for today, Mr. Chairman. I just got a closed session, but I'll wait on you.
I got one little thing. Commissioners, next, we want to do this officially. Do we need to do it? Yeah. So I'd like to add to the agenda an item in support of Senator Lowe's bill that is creating a horse racing commission, which we hope will stimulate horse racing at Tanglewood, certainly throughout the state. And I'd like for us to take a resolution that would show our support for that particular bill. Several years ago, we had something similar and the board voted unanimously to support it, and I hope we can do that again. So I'm asking that that be on the next agenda for May 6th.
And I might add that there's another thing I'm excited about. Commissioner Kaplan has all kinds of grand ideas. Thank you, Commissioner. And they're off. I mean, we're almost finished. That's good. Any further comments or thing we need to talk about, Mr. Manager?
Not unless there's anything from the commissioners.
Okay. Well, Commissioner Linville, I'm glad you were able to attend today. Commissioner McDaniel was unable to be with us today. She's on a little vacation. Commissioners, any further comments before we adjourn? We do have a closed session. But if we have no comments, Commissioner Kaplan?
You ready for me to read the closed session motion?
Yes, sir. Please
All right.
do.
Need to ask the board to consider a motion to go into closed session to discuss one matter, to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee pursuant to provision of General Statute 143, 31811A6. Since there's no other business to come before the board at this meeting, following the closed session, the meeting will be adjourned.
Commissioner Kaplan. I second the motion. All in favor, say aye. Aye. We're adjourned.